Actually did not want to give me their health history. People don't really even want to find out. They don't want to be screened because they're worried about what's going to happen and are they going to get booted off of their plan. I left my office because I was burned out, and that's pretty common. And I was the fourth one to leave that office in about 4 years. So it's not medicine. It's the business. It's the struggle.
I've had a little bit of experience, a very small amount of experience with being a patient in the French healthcare system. And again, the doctors there had a very nice office, had a nice car. Obviously, the doctor has a nice standard of living. The office was very small. There wasn't any room for office staff. We don't need any office staff because most of that office staff is there for the process of billing. They're not there for the process of patient care. They're there for the process of getting the doctor paid for the patient care. And so with the very simple system and the very simple interface between the doctor and the system that they have there, they're able to, again, cover everybody, do it for about 60% of the cost that we have, and in France have the highest rated healthcare system in the world. Finally, somebody a few years ago actually did a study of that. And, you know, you can say anything about stuff like that, but somebody finally actually did a study where they did a large-scale survey of Canadians. And remember that most of the population of Canada lives within an hour's drive of the U.S. border because most of the population is concentrated in the southern part of the country. And what they found was that 0.4% of the population of Canada had ever in their life come to the U.S. for health care. And that's basically the claim that people come to the U.S. for health care is basically a lie. And there are several of them who make their annual pilgrimage to Mexico, where they get their new eyeglasses, they stock up on their year's supply of drugs, and they get their dental work done. And there's several little cities just south of the Arizona border in Mexico that just their whole economy of those small towns is built around providing health care to Americans who come down there for health care. In France, which is medical education is hard to get into, difficult to do, but free. That's what it should be. You know, it should be challenging to do it, and they have about twice as many primary care doctors per capita as we have. You know, you want high-quality doctors. You want your medical education to be demanding, but you don't want money to be a barrier to it. That's the way it ought to be.